How does a skin biopsy work? Step by step. Imagine trying to solve a mystery about your skin. A skin biopsy is like collecting a tiny piece of evidence to help doctors figure out what's going on beneath the surface. It's a common and safe procedure used to diagnose skin conditions, especially skin cancer. Let's walk through how it works from start to finish. First, the doctor will explain the procedure to you, including what to expect and any possible risks like minor bleeding or infection. They'll ask for your consent before moving forward. The area of skin that looks suspicious or abnormal is then carefully chosen. Usually, they pick the most unusual part of a lesion or spot that looks different from the rest of your skin. They try to avoid sensitive areas like the face or hands when possible. Next, the skin around that spot is cleaned thoroughly with an antiseptic solution such as alcohol or iodine. This step helps prevent infection. Once the area is clean, the doctor will numb it with a local anesthetic, often lidocaine. They inject this into the skin, which causes a small raised bump called a wheal. You might feel a quick pinch, but the area will soon become numb. The doctor waits a few minutes to make sure the area is fully numb before proceeding. Now the actual biopsy begins. There are different types of biopsies, and the choice depends on the size and nature of the lesion. For a punch biopsy, the doctor uses a circular blade to rotate into the skin, cutting through the outer layer, the middle layer, and sometimes into the fat underneath. This creates a cylindrical sample of tissue. For a shave biopsy, a small razor-like tool is used to shave off a thin layer of skin, usually 4 superficial spots. An excisional biopsy involves removing the entire lesion along with some normal skin around it, often with a scalpel. Once the tissue is cut, the doctor carefully removes it using forceps or scissors, making sure not to damage the sample. The tissue is then placed immediately into a labeled container with a special preservative solution. This keeps the sample fresh and suitable for testing. After the sample is secured, the doctor stops any bleeding. If stitches are needed, especially for punch or excisional biopsies, they will be placed to close the wound. Shave biopsies often don't require stitches. The area is then covered with gauze and a bandage to protect it. Following the procedure, you'll receive instructions on how to care for the biopsy site. Usually, you'll be advised to keep it clean and dry for at least 24 hours. Proper wound care helps prevent infection and promotes healing. Finally, the tissue sample is sent to a pathology lab where trained specialists examine it under a microscope. They look for abnormal cells, including signs of skin cancer. The results help your healthcare provider determine the next steps, whether that's further testing, treatment, or monitoring. This step-by-step process ensures that the diagnosis is accurate while keeping you comfortable and safe. Remember, always consult with a healthcare professional for personalized advice and follow their guidance for any skin concerns.